Thank you for joining us for Talking Sleep, a podcast of the American Academy of Sleep Medicine. I'm your host, Dr. Seema Khosla, Medical Director of the North Dakota Center for Sleep in Fargo. Today's episode is brought to you by apnea. As technology continues to permeate every aspect of our lives, the subset of sleep-related technology continues to expand. The AASM Emerging Technology Committee continues to assess both clinical and consumer sleep technology. We have previously discussed consumer and clinical sleep technology that largely centered around snoring and obstructive sleep apnea. Today, we have two members of this committee here to discuss the latest sleep technology for insomnia. Dr. Shalini Paruthi is an adjunct professor at St. Louis School of Medicine. Dr. Sachin Shah is an assistant professor of internal medicine and clinical director of medical technology commercialization at Indiana University. We cannot cover every single technology and product, but we are highlighting some of them to represent a group of technologies, and this in no way is an endorsement. Welcome to you both. Thanks for joining us today.
Thanks for having us.
Thank you for having us.
So we are very eager to learn what you have for us today. So I'm kind of wondering how we should approach this. Should this be by category? I was kind of thinking maybe we start with something that maybe a lot of us already use, like digital CBTI.
Yeah, I think that's a good place to start because there's such a wide range of apps, devices, and technologies out there. And I think starting with something that's closer to what's recommended as first-line therapy or as close to it as possible is a good place to start.
Yeah, so tell me about digital CBTI. What does this look like now?
So digital CBTI can essentially is a way for patients to get access to CBTI without the use of a psychologist if they don't have access to that. And there's a wide variety of apps that are available out there, and most of them employ some components of cognitive behavioral therapy for insomnia, but it's just delivered through a digital platform. So in theory, they should include things like sleep hygiene, stimulus control, sleep restriction, and may include things like relaxation therapy and mindfulness, in addition to cognitive therapy, and maybe some ways of preventing relapse. And then they can be either automated, where the entire platform is automatically delivered without any sort of intervention by a provider, or they can be self-guided, where the patient sort of does it on their own, but there's no locks and there's no there's not a set schedule for them, or it can be sort of an auxiliary treatment where a provider can use it in conjunction with meeting with a patient, and it can kind of work in tandem with them.
So that's what I was kind of wondering. Is this something that people are finding sort of in the wild and utilizing before they see you, or is this something that you bring up when you are addressing insomnia?
It's not something that I've had any patients bring up with me personally before. I've recommended to them. I've had, referrals from, primary care doctors or other providers, for treatment of their insomnia. And oftentimes they may have tried some of the other apps that we may discuss later on. But usually it's something that I'm referring to them, especially if issues such as they don't have access to a sleep psychologist or someone who's trained in this, or if cost becomes an issue, or sometimes some patients are just more comfortable with doing something digitally rather than having an in-person meeting with someone if, distance isn't also an issue.
Yeah, that's a huge problem, isn't it? I mean, I know where I am, finding in-person CBTI is really, really challenging. Shalini, what's it like for you?
I would agree that there are definitely challenges for patients getting access to CBTI. Even within the community I live in, we have several providers, but they're so busy. And so sometimes it can be difficult to get an appointment and start establishing and getting therapy. And that's where I believe that sometimes some of these other digital options can be helpful.
And so how do you do this? Like, how do you deploy it? Is it sort of as they're waiting for an in-person CBTI, or is it sort of, let's try this first, and if you don't do well, then we will refer you? Or is it kind of meant, Sachin was saying this earlier about maybe refreshing. Somebody's been through CBTI and they just kind of need a tune-up.
All of the above.
Yeah. And so, I mean, in practical, so for me, in my clinic, we know we're not going to realistically have somebody see somebody in person for a really, really long time. And so we will routinely talk about these digital CBTI platforms. And some people have done really well with them and some people don't. And so I'm kind of wondering, has this ever been considered as like part of a guideline? You know, Shalini, you had talked about ACP guidelines for insomnia.
So the ACP insomnia guidelines are from around 2017. So at that time, I'm not sure that we had as much evidence as we could now today, given that with COVID and making digital health or making telehealth much more come to the forefront, where people are more accepting of digital therapies, people are more, accepting and have more access to digital health and telehealth visits. I think now would be a good time for us to take a look at, are they as effective as in person as well?
So what about the ASM? Are there guidelines there?
So we have the clinical practice guidelines from 2021 on behavioral and psychological treatments for chronic insomnia disorders in adults. And at that time, with the grade designations, they had very strong recommendations for CBTI. But on the other hand, they did say there was the caveat that there's insufficient evidence to make recommendations for specific delivery methods, such as individual, group, internet, self-help, video. So I think as time has gone on, now we should have a lot more information, and hopefully that is being studied so we can evaluate how good or how well digital therapies will work.
So is this something that has to be cleared by the FDA?
As of right now, it is not. There was only one digital CBTI app that was FDA cleared, but that has been bought out and went bankrupt and bought up by Knox Health. And all the rest right now are not regulated by the FDA. But with the transition of digital apps and prescription digital therapeutics becoming more in sight by the FDA, that could very well change in the coming years.
Yeah, and you're right. I love how you describe that prescription digital therapeutic, because I feel like we're seeing more of that. Like people talk about the sleep pill, right? And it's a sort of digital CBTI or digital relaxation or something like that to help people fall asleep. So do you think if we were to use one of these platforms, would that qualify for RTM coding, or do you see this more as being completely patient-driven without physician input?
I think we're approaching a transition point in that as well. As you know, RTM has not traditionally been something that's been used, I feel, as much within the sleep world. And I think that's starting to change. And right now, as far as I'm aware of, that's not been something that has been done. But could it fall within that purview? It very well could. And I think that as this continues to grow, as more and more digital therapeutics for CBTI are developed, that could very well change, because there is time that can be dedicated if you as a provider are taking that time to review the information and making adjustments to and making specific recommendations through the app. Then that might be something that could happen. But as of yet, it's not something that I'm aware of that is in mainstream.
Yeah, I'm actually kind of looking forward to that, because I feel like, so in my old office, my office looked out over our parking lot, and I would see people drive up for their appointment. And I would often kind of like peek, if I happen to see them and they're in their car, like filling out their sleep log. So then I'm like, okay, I know how this is going to go. So I am really excited about this idea of maybe you kind of like offload that burden of the sleep log, for example, right? And you use whatever technology, and then you can kind of help them with, okay, look, you're spending, 10 hours in bed, and we really need to shorten this to improve your sleep efficiency. And I feel like maybe there's dialogue around that with some of these digital therapeutics and apps. Even when we look at wearable data in clinic, I feel like there's a little bit more education around this sort of thing. But I don't know if that's just me. Is that something you've observed?
I've definitely observed it, and I agree with you. It's always fun to look at the sleep logs, and it's all been one pen scratched out for the entire 2 weeks all at once. And you're like, well, you clearly filled this out. And I do like some of these apps which put a restriction on how far back you can go to log in your sleep. So, it sort of does give some level of credibility, and not just credibility, but puts the onus on the patient to be responsible for what's going on, to do it on a timely manner.
Oh, I didn't know they did that.
There's a few that can do that. Not all, but there are some that will put that restriction. And there are some that will put a lock on, you can't proceed to the next module until you've completed this module, which is a very automated way of doing it, but which can be good or bad depending upon what are the symptoms that your patient is having, and if that particular module is something that's going to benefit them the most. And, as these develop, there could be more AI involvement to specifically tailor treatments that will best benefit a patient with a specific problem.
So, Shalini, what is new and unique out there in the world of technology and insomnia?
So this is a loaded question, right? Because, even when these guidelines were made, they always describe in their methods that their literature search involves looking for those randomized controlled trials. And as clinicians, we're always looking for the best evidence. As patients, even when we go to see our doctors, we're like, ooh, what is evidence-based, right? What has evidence that is really going to work for me? And I think that's where some of the technologies and devices that we will discuss today fall into this gray area, because we know that it's been very clear that cognitive behavioral therapy for insomnia is a recommended therapy before pharmacologic hypnotic therapy. And even if we incorporate alternative and complementary medicine, those still typically don't go into products like devices and technology. A lot of that might be more like herbal or acupuncture or other therapies. And so, I think that's where we sort of look at what has enough evidence that it actually has received some FDA clearance or designation, what has some studies that even if the company that puts out these products, they may sort of describe these studies on their own websites. And then I think sometimes it's really in the hands as all of us as consumers. We are clinicians, but we're also consumers too. And so, we have to thoroughly look through the online reviews that other people have put, knowing that they contain an enormous amount of subjective information there. And then sometimes we're just outright guessing. So I think sometimes with these products, that sort of is a limitation for sure.
So what do you see that's kind of the latest and greatest, or maybe something that we haven't seen before?
I think, if we sort of are transitioning, speaking about different apps, I would say that in general, as we pointed out earlier, that the only FDA-approved app for the treatment of insomnia is the Somryst digital CBTI app. However, there's a lot of different apps that utilize some components of CBTI and also a very similarly themed acceptance and commitment therapy, so ACT type apps. And then if we look at apps that have the most amount of studies that they've included, either that are published and you can find these in PubMed or that are on their own websites, that's where you're going to see the apps of Calm or Headspace have the most number of trials, including some randomized control trials. You'll also see apps like Sleep Easy or Doze that also feature studies and results on their apps. I think the other thing that is really important when we think about some of these apps is some of them are just going to be good to collect information. So thinking of those sleep diaries, thinking of our sleep metrics, like our physical characteristics like heart rate and movement and things like that. And then it just provides the person using that information with a lot of information that then is in their court. What do they want to do with that? Whether that helps them make some associations with what they're eating or drinking or movement or lack of movement, things like that, exercise. And then they can sort of start to make some of their own changes.
But hasn't that been one of the criticisms, that when you have a wearable or a tracker, you're tracking something, But then, okay, so what? Like, isn't there,
Exactly.
right? Like the whole thing about 10,000 steps and everyone was going to be fit. And people started saying, yeah, I know I don't move enough, but it wasn't enough to make them change behavior. And so that's what I'm wondering about these sort of newer devices and apps or gadgets or whatever. Is there that piece that then allows them to change their behavior?
Exactly. And so then you have some of these apps that actually take that information, synthesize it, and then deliver some feedback and give you some recommendations on how you could improve your sleep. Or it might, use that information, and then it also has a feature for an alarm, which quote or claims that they can awaken the person when it detects that that person is in the lightest stage of sleep. So now you have some like feedback, and then the device is giving you some therapy from that standpoint. And then we have different ones that are going to deliver therapy in terms of like, especially when we start talking about like products in bed or things that actually cause like temperature regulation, or maybe it tries to soothe your senses with a vibration or a rocking sensation or sounds. So I think, some of the apps that can be really interesting as a committee, as we were sort of going through these, is that there are a number of apps that are soothing or have appealing sounds, some that provide guided imagery or help a person with meditation. Some of them really guide people in breath work, some are short stories. And I think that probably the most important thing as I was evaluating several of these different apps is it's going to be very specific and individual to each person, what they like, what they found was helpful for them to fall asleep and distracted them from, the numerous thoughts that can sort of enter our minds as we're trying to fall asleep at night. And along with that, I found that most of these different apps allowed you to do like a 1 week free trial. And then if you liked it, you had different options of signing up for like a monthly price, or you could sign up for the whole year price. And so you had some different options there that it wasn't like once you signed up for it, oh my gosh, now you were stuck with it. So I think that was really helpful for me to see that. There are a few different apps that were designed specifically like for children or teens or young adults in mind. So Calm had a lot of good options there. And then, I think sometimes we see insomnia, especially in our patients who are shift workers. And so there were a couple of different apps like Sleep Sync or Archoscope that were very much geared to helping people sort of figure out a sleep schedule that could work. We also saw some apps that even were specific for jet lag. We also saw there's an app called Dream App that they explain it on their website that for people who have unexplained dreams that disrupt their sleep, then you could provide what your dream was. And then based on like published studies, they provided interpretations and feedback. So
wow. Okay.
Right. So I think that there's a lot of educational and supportive resources that are available.
Very interesting because, people often ask about what their dreams mean. And I am very clear that, I don't know. I mean, we've seen some where people dream that they can't breathe and then they get on a CPAP and those go away. So those ones, I feel like that I could probably manage. But all this other stuff, I'm like, nope, I'm sorry. I don't know what that means.
I think the one thing also, and I think Shalini brings up a good point, is that there's just so many different apps out there. And I think our patients are likely to come to us with any one of these. And I think it's important to somewhat keep an open mind and kind of meet them a little bit with where they are and balancing that with what we know works and what the evidence actually shows. But being able to meet them somewhere in the halfway point is an important thing.
Yeah, I think that's really important, especially because they've invested time and effort and sometimes money, and you don't want to be dismissive. I think it's healthy to talk about it and sort of have discussion around, sort of performance of whichever device, right? And sort of in the context of the clinical picture. And so it's not just what the app or device says, it's sort of in the context of how are you sleeping. Are there some that, at least that's kind of my framework, Are there some that you see more than others? Like, are there some that you see every week in clinic?
I would say from a perspective of apps, most people have come in and said, I tried Calm or I tried Headspace.
Mm.
And then that's where we can sort of have a conversation of, well, if we've tried CBTI already or we're waiting to get in for CBTI, then I can still offer them another non-pharmacologic option and say, all right, well, there's a lot of different categories of apps and seeing if there's something that they might be interested in.
So let's take a short break, and when we come back, we'll talk more about sleep technology for insomnia. You're listening to Talking Sleep from the American Academy of Sleep Medicine.
Dive deeper into the future of sleep apnea therapy with the Apria Sleep Care program. Once we receive the PAP referral, our team springs into action, offering patients a seamless transition into therapy. Patients start by selecting how they want to begin their sleep journey: in-person care, virtual care, or self-directed care. With ongoing therapy support, including coaching, digital resources, and video assistance, we're committed to ensuring every patient's success. We stay connected with our patients with live calls, texts, emails, and IVR, all designed to make adherence a breeze. And with our supply schedule program, replacements are delivered like clockwork. Experience the difference of an enhanced sleep therapy program with Apria Healthcare. Discover more about our innovative sleep program online today at apria.com.
Welcome back to Talking Sleep. We're talking with Dr. Shalini Paruthi and Dr. Sachin Shah about the use of sleep technology to help our patients with insomnia. So what about nearables? Tell me about those for insomnia.
So nearables are the set of devices that that are placed near the bedside, are not worn on the patient, and what they're usually anywhere between 30 centimeters to maybe across the room or even further. And usually they use some sort of Wi-Fi or radar to detect, maybe heart rate, body position, respiratory rate, and from that try to determine if the person is sleeping or not. And there's only a few that are commercially available. There is one that is FDA approved, Sleep IZ. I'm not sure if I'm pronouncing that correctly, but it then provides some CBTI based off of that. But most of them will then, as Shalini referred to earlier, will then try to not only provide the sleep, track the sleep, but will then provide some sort of output to try to improve the sleep, usually being some sort of light or sound that can be adjusted to kind of help the patient fall asleep faster or wake up at a more appropriate time. How effective these are, I think, is still really not been well studied or well proven at this point, though.
Yeah, I mean, that's interesting, right? To utilize that device to assess sleep or not sleep when it's not touching the patient.
Yeah, and I think that evidence is growing in the efficacy of being able to monitor someone without having devices, without having something worn on them can be very effective potentially. I think just especially because people usually tend to sleep in the same spot. They're not traveling all the time for most people. So it could be an effective way. I think that just how do we translate that into something that can actually impact the sleep and improve the sleep quality? That aspect has not yet been addressed.
I actually have that device upstairs. I like playing with a lot of these things. So, I set it up and I was like, okay, let's see what this does. And I mean, it was kind of interesting. Like, it did pick up when I was awake, and I was like, oh, okay, this is interesting. I'm excited to learn more. So, Shalini, what about this category of acoustics for insomnia?
So acoustics are definitely an emerging field. And so the idea is, how can we use sound to improve sleep quality? And it could also be, how do we use sound to help people fall asleep or stay asleep better? And the technology so far that seems to be out there could be the auditory stimulation, like white noise, pink noise, binaural beats, personalized soundscapes, or just kind of creating that environment that is conducive to sleep. And so just like with anything else that we're trying to use to help us with insomnia, we're trying to either mask other noises in the environment. Maybe there are some noises that help people become or feel less stressed or less anxiety. Maybe it helps them sort of lower their heart rate, breathe a little bit slower. And so we have some different devices that we came across as a committee. So, for example, there is a product called the DreamPad. And so this has a patented vibrational sound system that's inside of a pillow. And so it gets activated when someone rests their head on the pillow. And then what their system claims to do is convert traditional sound to resonant music. And it has like a specifically engineered proprietary music that may be calming or have positive effects on sleep. And it uses conducted, like vibrational conducted sound. So only the person touching the DreamPad can hear it.
Ooh, interesting.
And then, of course, we know that there are lots of different products out there that are sort of in a headband type form where it's going to play different sounds or music or noise masking or soothing sounds. And so there are a lot of different products that people could sort of find online and see if they find one that they find might be something that they could tolerate wearing overnight.
Does that get into neurostimulators for insomnia?
Sure, we can talk about that too.
So tell me about that. What is that?
These are transcranial electrical stimulation devices. And, the earliest research actually goes back to the early 1900s. And so when we think about electrical stimulation therapies, there are invasive, like deep brain stimulation, or there's non-invasive brain stimulation. And so then we get into categories of transcranial magnetic, ultrasound, or the cranial electrical stimulations. And so even that can be further classified into transcranial direct current.
Okay.
There's alternating current and random noise stimulation, and also vagal nerve stimulation. So there's lots of different categories here. Now, what has been studied for insomnia is actually the transcranial alternate current systems. And so those are the ones that are available. And what that means is that, now this is going to sound very scientific, the current and polarity of a sinusoidal current alternates every half cycle between the two electrodes with the goal of modulating or entraining brain waves. And then maybe that might affect like neurotransmitters or hormones. And again, the idea is, can we induce less anxiety and then, of course, help the insomnia at the same time? So the first of these transcranial or cranial electric stimulation devices was FDA cleared in 1978.
Oh, wow.
And then, yes, and then that has been used as a predicate device for the others that have followed. And that carries its own controversy too, because most of the CES devices that are marketed today, direct to consumer or by prescription, actually have not been involved in a whole lot of studies. And so sometimes that's very confusing. And so in 2014, the devices were reclassified as Class 2, which is moderate risk, and that means that they were intended for the use of insomnia or anxiety. And then there was also Class 3 designation, which is intended for the use of depression, as well as anxiety and insomnia. And so out of all of those electrical stimulation devices, it's the Alpha Stim devices, which have come out in multiple iterations over time, that really have the most number of publications, clinical trials, like information on their website for the treatment of insomnia. And I think that's where it's also important to point out that with these CES devices, most of them will have data for anxiety, but because they get that Class 2 designation FDA, they can also say, well, if it helps with your anxiety, it might help with your insomnia too. And some of them do have some data on their websites as well for that.
Interesting. That I mean, how do you know what to choose and how to use it? Or is it something that is patient driven in terms, and I'm thinking about like voltage and duration and frequency?
These are excellent questions. And so, in our review of these devices, what we found is that in general, they're very similar. So, for example, like with the Modius sleep device, it's like a small device, so that's handheld, that would kind of remind you of like back in the old days holding an iPod. And then it's got two electrodes that are connected by wires. So you attach those like either to like the earlobes or the mastoids, and then on the handheld device, that's where you're going to be able to change the intensity of the stimulation that's coming. And so they recommend, like most of these devices will recommend for, where you get approximately 30 minutes up to 60 minutes. Of course, every person would need to read the exact instructions for each device. And then in general, they're recommended to wear them in the evenings, like during a quiet time. It could be, approximately an hour before bed. It could be a little bit earlier than that. And, they all recommend starting at the lowest intensity and then working your way up over a series of evenings. And that way a person can really sort of fine tune or tailor that therapy for themselves.
So is there a whole other category about the things that are actually in bed with patients?
Yeah, so there's a whole set of devices that can be placed like in the bed or under the sheets, under the mattress, that usually use some sort of pressure sensor or piezoelectric to detect if a person is sleeping in the bed. And from that, there are a couple of some interesting ones like Chili Pad that will adjust the temperature, or like BedJet that will do these sort of things. Some that will maybe give a massage to help the person relax, or change the positioning of the bed to help them sleep better and reduce heartburn. I think ones that people have young children, there's Cradlewise as well as Snoo, which are meant for infants, that will try to detect based off of movement and sound potentially if the baby's woken up, and then we'll start to like maybe rock the crib and maybe play a nice soothing sound to help them fall asleep. So I'm sure there might be some parents out there who would really like that.
Wow, where was that, a decade ago?
Right. So I think that's a growing field of more devices that will try to improve sleep based off of that. I think, though, there's still a lot of work just with the lack of literature and evidence, and the ones that are out there. There's really no good randomized controlled trials that really show that this has been effective, that can accurately detect sleep or versus awake and can make a significant impact. But there might be patients out there that still might benefit from this, and they feel that their sleep is better. So I think that's the important thing to keep in mind.
So how does that conversation go in clinic when you have somebody that comes in and they have, sleep onset insomnia, and, you have the conversation about CBTI and probably digital CBTI and hypnotics. And is this sort of a conversation that you bring up about, transcranial stimulation or the things in the bed or the neurables or the acoustics, or is this really driven by patients?
For me, it's been something that's been driven primarily by the patient. Usually it's been something that I ask them, I'm like, what have you tried? Are you on any medications or anything else to help you with your sleep? And they're usually the ones that will have brought up something like this, or that they've been struggling with it and they've looked it up and they want my opinion on that. And usually, obviously, I'll first try to steer them to the first line therapy of CBTI or digital CBTI. But sometimes patients have already tried that, and then we have that discussion of, well, did you find it helpful? If not, why not? Or if they did, usually I'm like, understanding that if you feel that it helps you, my personal view is go for it if that's helping you and it's not hurting you. That's sort of my approach to that.
How about you, Shalini?
I would agree wholeheartedly with that. So starting with where the evidence is, but then if someone has a reason that, CBTI didn't work, they have no access to it, they're unable to get it covered by insurance, even if it's digital. And and then they really don't want to try medication or had a side effect or just can't take it because it interacts with other things, then I think it's great that we have some other options for them. Granted, we have to give them that disclosure that a lot of this is in that gray area that we don't have the evidence for, or the evidence might not be as strong, and that it may or may not be FDA cleared, but it still gives them an opportunity to try a few other things. And I think that's the really other keyword is try. And so they can sort of see if it works and sometimes they may find or try different things and then realize that it didn't work for them, but oh my gosh, it worked so well for someone else that they know too.
Sure. Yeah. And that's true, right? Everybody is so different.
And I think that we all have a different tolerance of the things we can tolerate either on us, near us, in bed with us. And, I think one of the categories that we sort of have approached but not gone into is that, with these wearables, it's amazing that they come in the shapes and sizes and forms of sleep masks and skin patches and necklaces and headbands and watches, rings, socks, belts, and then, of course, the more typical like actigraphy or accelerometers that we think of.
Yeah, and it's funny, right? Because I like all these gadgets, so I have all of so many different things. And when you said that, I was thinking about my poor husband. I had set this this device that had 2 speakers, and so one went on his side, one went on my side, and it kind of combined pink noise or whatever with a soundscape. And it started, it was playing, and my husband just starts laughing. He's like, "What is that? What are you doing now? What gadget are you subjecting me to now?" And so that just kind of tickled me when you said that. So where can our sleep medicine colleagues learn more about this? I mean, what resources has your committee created?
Yeah, so providers can go onto the AASM website and check out #SleepTechnology, where we try to do a review of technologies that have been up and coming, and we're constantly reviewing all the new technologies and trying to provide a sort of cursory overview of that technology and some of the evidence and literature behind it. Obviously, people can always go into more in-depth reading by checking out the literature themselves, but that is what we try to do, so that way for people who don't have the time, they can get a good broad overview of a lot of these technologies. And if people find technologies or they have patients that come up with a question with a technology that we haven't reviewed, we'd love for them to send in an email saying, "Hey, could you please review this?" And we'd be happy to do that.
And then do you have something coming up in Montage?
We do. So we will be reviewing different technologies that are available for helping people track their sleep, some that deliver the feedback, and of course, those that deliver therapy. So a lot of the things that we talked about today will be in the fall issue of the Montage.
If somebody has a device that they would like to request that the committee review, how should they contact you?
Yeah, people can, there's a contact form on the website that people can fill out, and they can kind of give a little bit of information on what sort of app or device they want us to review, and we'll take a look at it and review it.
Okay, so we'll include all of that information in the show notes. So, final thoughts, Sachin?
I think this is a growing field, and it's an area that's going to continue to expand with the use of digital technologies as our younger populations get older and people get more used to technology. And I think it's up to all of us to kind of be on top of it and stay up to date and be open to these things as changes come along. But I think it's going to make a significant impact and hopefully improve the sleep quality of our patients over time.
How about you, Shalini? Any final thoughts for us?
I think this committee has been one of my favorite committees to be on, and part of it is that technology is moving at such fast speeds that it's outpacing researchers' ability to really get in there and see how efficacious each of these different treatments are. And so I think we all have to really remember that as we don't on the committee endorse any of these products per se, and that we really have to leave it up to the consumer, our patients, to really still take a look at what it is they're buying, if they're buying some of these different technologies that are not FDA cleared, that don't have randomized control trial research, and you might be relying on other kind of group sourcing of comments and reviews from other people. But they are still very important, especially if it can help people treat their insomnia and still fit within what they want, which is if they don't want to start a medication or couldn't take a medication.
Yeah, I love that idea of sort of meeting them where they are. And this allows us, to have more of those conversations with our patients. Well, thank you both for joining us today and for teaching us about the latest technology for insomnia. We'll include the links for the #Sleep Technology website and the article and montage once it's available.
Thanks for having us.
Thank you. It's been great.
Sleep, brought to you by the American Academy of Sleep Medicine. For more podcast episodes, please visit our website at aasm.org. You can also subscribe through your favorite podcast service. And if you enjoyed this episode, please take a moment to leave a rating or review. For more feedback or suggestions, email us at podcast@aasm.org. I hope you'll join us again for more Talking Sleep. Until next time, this is Seema Khosla, encouraging you to sleep well so you can live well.